Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's understand the barium swallow in detail and some very important radiological findings. So in case of DES, as we know, it stands for the diffuse esophageal spasm. So this DES, it is used in case of it is seen, the corkscrew appearance is seen on the X-ray. This is the DES. Then moving on, there is something known as a feline esophagus. There is something known as a feline esophagus. So this feline esophagus is nothing but a transient transverse band seen in the mid and the lower esophagus. So it is seen in the mid as well as the lower esophagus. It's a transient transverse band. It is nothing but a transverse band on a double contrast barium swallow. So this is on a double contrast barium swallow, and it is seen in case of the active gastroesophageal reflux, hiatus hernia, as well as the esophageal esophagitis. So it is seen in case of the gastroesophageal reflux GER, the hiatus hernia, as well as the eosinophilic esophagitis. So this is where the feline esophagus is seen. Then moving on, we look at what is known as the achalasia. So here this achalasia is nothing but a dilated esophagus with the retained column of barium and a Bird-Beak sign. So it is nothing but a dilated esophagus. So there is presence of a dilated esophagus and it has a retained column of barium and a Bird-Beak sign. So retained column of barium. So it has a retained column of barium and also it has a Bird-Beak sign. Then moving on, we look at the Zenker's diverticulum. So the Zenker's diverticulum is nothing but a posterior outpouching of the hypopharynx through the weakness of the muscular layer. So it is nothing but a posterior outpouching. This is in the hypopharynx. Posterior outpouching in the hypopharynx, and this is due to the muscular weakness. So there is presence of muscular weakness, and this is known as the Killian dehiscence. Killian dehiscence. Then moving on, we look at the esophageal carcinoma as well as the Schwarz's ring. So what is the esophageal carcinoma? So esophageal carcinoma, there is irregular narrowing and mucosal destruction and shoulder margins. Irregular narrowing. Next you have mucosal destruction. Another mucosal destruction as well as the shouldered margins. Next we look at the Schwarz's ring. The Schwarz's ring is nothing but a thin submucosal circumferential ring in the lower esophagus, and this is in the SC junction. So you have the Schwarz's ring. So you have something known as Schwarz's ring. It is the thin submucosal circumferential ring. So thin submucosal circumferential ring. So thin submucosal circumferential ring, and this is present in the LES, that is the lower esophageal sphincter, and this is present at the squamous columnar junction, SCG. Next is we move on to the something known as the esophageal web. So what's happening in the esophageal web? So esophageal web in a patient with the PES. So you have the esophageal web. So this esophageal web is seen in case of the PES. PES stands for the Plummer-Vinson syndrome. Plummer-Vinson syndrome. So the esophageal webs are thin membranes of the normal esophageal tissue. It consists of the mucosa and the submucosa. So they are nothing but thin membranes of the normal esophageal tissue, and it contains the mucosa plus the submucosa. This is the esophageal web, and the translucent part, it denotes the esophageal web. So the esophageal web as such, it is a translucent part. Lastly, we move on to the esophageal leioma. So what's happening in case of the esophageal leioma? So here in case of the esophageal leiomyoma, so it is the most common benign tumor of the esophagus. So it is a MC, most common benign tumor of the esophagus, and on barium swallow it is seen as a discrete ovoid mass that is well outlined by the barium. So it is seen as a ovoid mass which is well outlined by the barium, and it borders from slightly obtuse angles with the esophageal wall. So it forms slightly obtuse angle with that of the esophageal wall. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.